Welcome to this short training video based on the HEE assessment strategy, which is available on the HEE website. This video is about contribution to care logs. What is a contribution to care log? A contribution to care log is one of the assessment tools that can be used to document assessment activities as part of the HEE assessment strategy. It can be used to describe assessment activities in practice and map these to learning outcomes where the activity is providing evidence for one or more learning outcome. Contributions should be documented that result in a change of prescription and when advice or information is provided to a patient or prescriber that results in improved outcomes to patient care. Please see the Assessment Strategy Guide for suggested activities for each of the learning outcomes. When to use and the preparation needed. All trainees are encouraged to keep a log of the day-to-day contributions to patient care. It is recommended that the contribution to care log is submitted and reviewed on a regular basis. It is expected that the contributions become more complex and demonstrate the ability for autonomous practice as the trainee progresses throughout the year. How to use the contribution to care logs. The log should contain sufficient information to enable a designated supervisor to gain a more rounded view of the trainee's work in practice and should include such information as the date, the intervention, the outcome of the intervention, the trainee's reflection on the event, and additional comments which can be discussed with the designated supervisor or practice supervisor. This form may look slightly different on the e-portfolio, but will need the same information. For example, today's date is the 30th of September 2021. The trainee is on a general practice placement. They have been reviewing a prescription for a patient, a woman with a urinary tract infection, and they notice that she is 39 weeks pregnant and has been prescribed nitrofurantoin by the doctor. Nitrofurantoin cannot be prescribed for pregnant women at term, so they decide to speak to their supervisor about this. The outcome of the intervention is that the supervisor has spoken to the doctor and got the prescription changed to cefalexin. They have also rung the patient to advise them of the change and asked her to supply a urinary sample, as this has not been done. Next, the trainee reflects upon the event. For example, they knew that there was an error on the prescription, but they did not have the confidence to speak directly to the doctor. They also did not look to see if a urine sample had been supplied. They will do this in the future. An additional comment from the trainee to discuss with the supervisor is that they would like the opportunity to speak directly to other healthcare professionals and prescribers about prescribing errors with supervision. The next day, they arranged a meeting to meet with the supervisor, the 1st of October 2021. And the action plans agreed upon were to role play a discussion with a prescriber, with their supervisor, receive feedback and reflect on this, and then speak to a prescriber directly under supervision next time a prescribing error is found. As you can see, the final steps are to arrange a meeting to discuss the contribution to care logs and agree the final action plans. The contribution to care log also needs to be linked to the relevant learning outcomes. This should be done on the e-portfolio. For further information on the contribution to care logs and to see which learning outcomes this can be mapped to, please have a look at the HEE Trainee Pharmacist Foundation Year Assessment Guide and Strategy, which are available on the HEE website. Within the HEE Assessment Guide are suggested activities for each of the learning outcomes. There are also many additional resources. For more information on the learning outcomes, please see the GPHC Foundation Training Manual on the GPHC website.